So thank you for joining us today. We're excited to talk with Mousumi Dey about healthy aging. If you have questions for her, you can post them in the chat and we'll get to them at the end of the program. So I'm going to start by introducing Mousumi. She has been a physician assistant in gastroenterology since 2014. She graduated from the Touro University in Nevada in 2013 and worked in Las Vegas. She relocated to Texas in 2016 when she joined UNT and now is with John Peter Smith Hospital and has been working at the Arlington Specialty Clinic. She was a physician in India and worked as a consultant with the World Health Organization. After relocating to the US, she worked as an assistant professor for more than 11 years at a university in Iowa. She was awarded the Fellowship in Nutritional Outreach by the Physician Assistant Foundation in 2020. So welcome. Thank you for joining us today. I am going to get your presentation started and then I'll turn off my camera and you can do your thing, and then I'll come back at the end for audience questions.
Thank you, Jennifer. Thank you for this opportunity. And I hope that the audience can take back some important information from my lecture today. So please go on to the, next slide. Next, yeah. So the topics that we are going to cover today are healthy aging, the foods to help you bounce back from after surgery, and nutrition in pre-diabetes and diabetes. Next slide. So our first topic today is healthy aging. Okay. Do you know how many adults that are reaching the age of 65 are estimated to live for how many years? Well, that is 19 years. That is an estimation as of now. Please go to the next slide. Well, that sounds great, but I'll show you that there are some other advanced countries or developed countries where people are living for much longer. Like in Japan, there are people who are living for more than 100 years and they are healthy. They're not unhealthy at all. Now, let's look at some of the statistics of aging in the US. So by 2020, which is last year, it was estimated that 1 in 6 will be older than 65. And by the 2030, about 25% or 1 in 4 will be older than the age of 65 years. So we can see that the population is aging, and so we will need to become more aware of the diseases that can affect the elderly and yes, and most older adults. So in my clinic, because I practice GI, most of my patients are above the age of 50 years. And I see them having a lot of comorbidities. And that was one of the reasons why I thought that it would be a good way for me to come on to this program and talk about all the or the more common comorbidities that affect older adults and how we can actually remain more healthy and as we age. So I don't know how many people are there in the audience today, but I'm guessing that many of you may be having high blood pressure, some may be having arthritis, some heart disease, diabetes, and cancer. So, or you may know some friends or family who are having or suffering from these comorbidities. Now, heart disease is considered to be the #1 killer disease, or the disease which causes mortality in the US. And diabetes is again becoming a very important comorbidity in the US today. About 21% of the population is suffering from diabetes and more from pre-diabetes. And therefore, this is become the 6th leading cause of death in the US. And especially in the Black and the Hispanic population, diabetes has become the fourth leading cause of death. So we have to be very, very careful about how we are living our life, because after all, we want to live in a healthy way, right? And not be on a wheelchair. Okay, next slide, please. So as you can see in this slide, in the same face, next slide. So you have this one person who is happy, who has some bright-eyed person with, she may be having white hair and white eyebrows, but, she's looking happy. Please go to the next slide. And you see the same, another person, this is a twin of that person. Look at her wrinkles. She is not looking happy at all. And she is looking confused, right? So let's go back to the previous slide. Okay, so see, everyone gets older, but not at the same rate, right? So we saw the two people, the twins, but one looked really old, her age, or maybe older, and the other one, maybe she was looking 20 or 10 years younger than her twin, correct? So why is this difference? Because both of them are sharing the same genetics, but yet one is looking older than the other. All right, so let's go to the next slide. And the next slide here. So this is slide number 8. So basically, so healthy aging allows us to be able to do things that we want to do, right? As we get older. And as I said, we are all getting older every day, every minute. So, but we don't realize that, or we don't really want to think about it, that we are getting older. But that's a fact, and that's a truth which can never go back. We are trying to go back to the slides and we are still going forward. All right, so, and this is unhealthy aging. What do you think unhealthy aging does? And I see this every day in my clinic. Confusion, dementia. People are having trouble walking, so they are coming in with, some walking device to support them to walk. They are having trouble balancing. And of course, we discussed all the chronic diseases that they are suffering from, especially diabetes and hypertension, cancer. So all these are now coming on and becoming very, very prevalent in the US population. So, the other things are more related to the socioeconomic factors, the social isolation that we really cannot ignore. But, and I see so many of my patients who are living alone and they're isolated, they're lonely, they don't have anyone to talk to. And it is interesting that some of my very elderly patients who come, they just want to talk to me. That, all day I've not been able to get out. I'm all the time sitting in front of the TV, or I'm reading a book or something, but I want to talk to somebody. And so I came to see you. So, and those things, are really makes me aware that how lonely people can be, and they can get depressed. And depression, and just as we treat the body, so we should also treat the mind. And nowadays, people are realizing this more and more. So people, even healthy people, can become depressed, and depression can then, lead to more and more ill health. People can. I had one patient. Let me give this example very quickly. So this patient, she was about 64 or 65 years old, and her sister brought her in. She had been losing weight very rapidly. Her initial weight was 136, but in 3 months, her weight had gone down to about less than 100, near about 97 or 98. And we were worried that she may be having cancer or something like that. And we had to, investigate and do all the workup, do the upper endoscopy, colonoscopy, and whatever we do as a GI specialist. We could find nothing. And I thought that she may be just depressed. So I asked her, what do you eat? She said, I don't eat. I said, you don't eat? No, I don't feel like eating. So why don't you eat? Oh, my sister doesn't, I don't have anyone to talk to. And then she started coming out with what she really does throughout the day. She does nothing. She's just lying in bed and thinking about different things. And that's about it. So she did not eat really, or hardly ate anything. And that was the result. And then when her sister came in and supported her, we could get her back to health very easily. So we can see, from this one small example, how isolation and loneliness can affect people and be a cause of unhealthy aging. So, and as you see, the next point is malnutrition, and I just gave you that example. So, trouble with everyday activities like getting plates from the cabinet, grabbing silverware from the drawer, or getting in and out of the bathtub or shower. I had patients who wouldn't take a shower, for days. I said, why? I said, I've got rheumatoid arthritis and I just feel scared that I may just fall. And so I have to walk like several steps to get to the bathroom. And so I don't take a shower. So then I had to call the social worker, and then we had a conversation, and then we could get her to a place where she could use the bathroom easily. So there are so many different things that we come to know and get to know our patients that we can help. But at the same time, I believe that if we start early and we talk to our patients, then we can actually help them much earlier, and they can help themselves. And also their families can understand what the problem is and then take the adequate steps to get them back to health. Let's go to the next slide. Okay, slide number 10. So, and as I was talking about the nutrition and the value of nutrition, as a GI specialist, I really became interested in nutrition because I have seen so many of my patients coming to my clinic just because they are having, a diet which is not healthy. For example, I have patients who come to me, telling me that they're having some ulcers in their mouth. And why is that? Because they're suffering from vitamin B12 deficiency or some, vitamin C deficiency or something like that. And that's why they have developed some ulcers in their mouth. Or, for example, they're very commonly, they have either constipation or diarrhea. Another very commonly I have seen is that patients are, either drinking alcohol, they're, or they're smoking, or they're drinking soda pop. I have really, this is something I have to deal with it every day. So I have patients who come in to say, oh, no, I don't drink alcohol, or I quit drinking alcohol, I quit smoking, but yet I'm having a lot of pain in my upper abdomen. I'm having GERD, heartburn, nausea. I cannot sleep at night. I'm throwing up. So why is this? And then I sit down and talk to them, and I find out that this patient has never had a drink of water in her life, or maybe because she just doesn't like the taste of water. Why? Because she's just addicted to drinking Coca-Cola or something like that, or energy drinks. And I had a patient, he was just 32 years old, and he had developed multiple peptic ulcers, and he was throwing up blood. And he later told me that he would drink only, nothing else other than, Dr. It's not the Pepsi, but anyways, one of those energy drinks. And that's what he would drink all the time. And that's why he developed these ulcerations. So anyway, so since I'm a GI, and it also affects not only the stomach, the intestines, it affects the liver, the pancreas, and so many other organs are actually, destroyed just because we are eating all kinds of foods without even thinking what we are putting into our mouths. So on top of the chart, of course, is the heart and the lung system, because, patients who are becoming obese. I mean, I've had patients who I'm really proud to talk about this, because those patients have been able to get off drinking the sodas, and they have lost weight. They are exercising, they're feeling much better. Their hypertension has gone away, and some patients, they have lost so much weight that some of them had been diabetic, and they are now, their blood sugar is controlled just because they stopped drinking soda. So you see, it can, affect our life so much. So one of the body parts, of course, as I was talking about, I got a little digressed. Heart and the lung system, of course, the heart attacks, and then feeling out of breath while walking, pain and numbness in legs. I had a patient who came in, and he was weighing 395 pounds when I first saw him. He couldn't even stand up. I mean, it was, when I first saw him, I got a shock, because I thought that he might just collapse, and I won't be able to save him. Guess what? After I treated him, and he had developed cirrhosis of the liver, though, but because he was alcoholic. But after treatment and control of diet and exercise, his weight came down to 220, which was so much more manageable. He was walking without any, device. And that was wonderful, because, he was enjoying life, and we just enjoyed because he was enjoying himself. So, those are some of the things that we want to see our patients do in our clinic. And of course, pain and numbness in legs, this neuropathy which develops from diabetes. I'm going to talk about that a little later on. And then the hormone systems, the diabetes and the hormones, they can go just crazy. The estrogen and the testosterone, having poor sex life, that can affect a lot of people. And that can make them feel really depressed, because after menopause, women can suffer a lot of depression, and so also men. So I don't deal with estrogen or testosterone levels, but since I get so many patients who are postmenopausal, I do have to take that into consideration also, because it affects the body, the psyche of the patient. Skin system, of course, and we all can have a little more or less, like the skin is too tight, and then so many people are, coming to the clinic, to the dermatologist, to get the Botox. Of course, another thing is the low vitamin D. So a lot of my patients are not able to take adequate exercise. They're not going out. They're not getting the sunlight that they should. And of course, the nutritionally also, they are not getting adequate nutrition. So they're getting low vitamin D. And when the vitamin D is so low, it can cause what is known as osteopenia. That means low bone mass, and then osteoporosis. So osteoporosis means that weakening of the bone structure, so much so that it can actually fracture. So that's why we become very concerned about patients who develop osteoporosis, and it is mandatory actually to get a bone scan done after the age of 65 years. And also there are certain medications that can make your bones more porous than others. And one of them is PPI, which I unfortunately have to write a lot. That is, those are proton pump inhibitors like pantoprazole or esomeprazole, and those kind of medications, which are regularly taken by my patients. And I have to warn them that, the course of these medications are from 6 to 8 weeks only, but some patients just cannot get off of it because they are not controlling their diet. And just because of that, they are having this heartburn and, gastritis and esophagitis and Barrett's and all kinds of complications. So, it is very important that patients, and this is the reason why I'm doing this lecture actually. And then the nerves, of course, if the vitamin B12 is low, then, poor vision, poor taste and smell, confusion, all these things can happen. And of course, I just talked about the poor bone mass and joint pain. So many of my patients come saying that, oh, I've got arthritis, osteoarthritis. So what can I do? So I'm having so much pain. I just cannot, survive. I have to take pain medication. So they are just taking, 600, 800 milligrams of ibuprofen 3 times a day. I'm like, no, you should not be doing that, because that, harms your liver. And then they're developing, advanced liver fibrosis and cirrhosis of the liver and all that. So, I have to educate my patients that this is not right. So you cannot take these medications. These are very harmful medications. And on top of that, they can cause ulceration. So you have to be very, very careful. So my whole point here is that, why do you want to develop these, problems? If you can actually eat a healthy diet, exercise, and, go, of course, we are all going to become older, but have a healthy lifestyle so that we can live better, all right, without having to take multiple medications or having to, land up in the hospital with some very serious conditions. Okay. So let's go to the next slide. All right. So as I've been talking about, so the role of nutrition in aging, I'll go quickly over this slide. So you'll have to really consider vitamins, minerals, the modes to prevent chronic diseases, what can improve your social life, like interacting with friends, more, networking, going out, walking, coming to the library. So coming to the Fort Worth Library would be a great way to, break the monotony of your life, have some interactions, attend some classes, listen to some lectures, discussions. I think that is definitely going to improve the quality of life. And we can start any day, anytime. It's not that, oh, I'm now, 40 years old, so I don't want to start it, or I'm 80 years old, so I cannot start it. No, it's not that. You have to start the day that you want to start. It doesn't matter, whenever you start, it's a good day. Okay. So let's go to the next slide. So, I just talked about what happens with poor nutrition, and I gave you a lot of examples. And so I see these patients who cannot move as well, who don't have enough mobility, or they're not able to drive, or they're not able to understand people as well, because if all the complications or the diseases that they're having, lose tooth. I have patients who, she came to me because she was just losing weight. Her husband brought brought her in. And then when I started asking her, what do you eat? She said, oh, I don't have teeth because I'm waiting for my dentist to arrive. And it's taking a really long time because I lost my teeth about a year ago. And all this time, I've not been able to chew anything. So I just slurp, or I just take liquid diet. So this patient had lost, she was initially weighing about 320 pounds. And by the time she was brought to me, she was weighing 125. So that was the amount of weight that she had lost just because she did not have teeth. All right. So also may lose taste or smell. And now due to the COVID situation, we are getting a lot of patients who have lost the, taste, or they have lost smell, and they're not able to eat. That if I cannot smell my food, if I cannot taste my food, I just don't feel like eating. So that's another thing that we are seeing in the COVID era. I cannot say that it's the post-COVID era because we are still going through this horrendous situation. And the other things are, the family support and, access to foods, whether there's a food desert that there's enough adequate food is not available. And if the patient is able to physically go to the grocery store, or if the food can be brought to the patient. And not only that, if the patient is able to get up and prepare the food for himself or herself. So those things are very important. So it's not just that the food is being brought to your door, but are you able to actually eat the food and digest the food and get the nutrition out of it? Okay, so those are the causes of poor nutrition, and we see these patients come to our clinic every day. So this is a very nice, and I will just click on that. This is another. So can you click on that, Jennifer?
What would you like me to click on?
Click on that. Click on that. The YouTube from the nutrition plan. Yeah, the consider how you eat.
Okay, hold on. I think I need to.
Mhm. So this is about 24-hour dietary recall, and we sometimes give this to our patients to write down and to maintain a food diary. And we discuss and tell them how to maintain a food diary, because this really works very well, because we don't know all the foods that they can afford, that they can eat. Okay, so this is a very individual chart. All right, let's look at this.
So where is the link? Oops.
So this is, if you just control and click.
Oh, I bet it's, okay, hold on.
Embedded. Yeah, it's embedded.
Yeah, I think I, control. Yeah, nothing's. For everyone who's watching, thank you for bearing with our technical difficulties today. So Mousumi, I'm clicking on the slide and nothing's happening.
Okay, so I will just talk about it. Okay.
Okay.
So, I'm just put the slides on. So basically, what we are talking about here is that 24-hour recall. Okay. So what happens is that we give our patients a chart, and we tell them that please record all the food that you eat throughout the day. So it is just not, the time of food when you are eating. So if you are eating, say, at 7:20 a.m., so you write down 7:20 a.m. And the next column is for what you are eating. So if you are eating, say, a boiled egg, so you write down boiled egg. And then the last column is the quantity that you eat. So you may eat one, or you may eat two. So whatever quantity you are eating, just put it down there. And then, so if your next item that you're eating is at 7:30 is a cup of coffee, then please write down that cup of coffee, and then put down if you're adding milk, or if you're adding sugar, or if you are just, it's a plain black coffee. So just, and how much. So are you drinking 1 cup, a shot, half a cup? So please write that down and put the quantity right next to it. So that's how we measure. That is the way that we do a 24-hour dietary recall. So once the patient brings that in, then we can go through and we know, okay, this is the way you are eating. And then we can sit down and discuss with the patient what the patient is eating every day, and how we can actually change the diet of the patient. So this is a very important tool that we sometimes employ in our clinics. Okay. If anybody has questions regarding that, please let me know. I mean, I don't know how many people are listening in, but I will be happy to talk about any of these slides. Okay. Let's go to the next slide. So, so what we really need more of, and a lot of research has been done in the nutritional aspects, which are concerning for older adults. And these are some of the important nutrients that we came up with, or the research has shown. And especially, dark green and orange vegetables, actually different colored vegetables. So you can dark green, orange, then what's that called? Aubergine. So different colored vegetables are always good because they contain they will provide a lot of vitamin B12, calcium, vitamin D, and magnesium, riboflavin. So vegetables and fruits, they contain a lot of different kinds of, and they can be eaten raw too. Some of them, like carrots, you can eat raw carrots, right? So those are and now you can get those kale chips also. So those are good. Then seaweed. So those are some of the very good nutritional supplements without taking any or spending more money on buying nutritional supplements. And of course, whole grains and dairy. Okay, so this is really important. And actually, research on adults aged 65 to 75 revealed that the diet that they are consuming, and this is from 2005 survey, that they were consuming is about 66% of the necessary nutrients outlined in the Healthy Eating Index of 2005. I do not know if the Healthy Eating Index has been updated, but I will try to find that out. But that's the value was, that's 66%. And it was interesting to see that people aged below 65 were consuming even less of necessary nutrients because they are eating foods which are just packaged, so which has lost most of the nutrient value. So, and the people who are 66 and 75, some of them are retired, and they can cook a little bit or something like that, and so they were getting a little bit more of nutritional value out of their foods. But again, so as I've outlined here, that dark green, orange vegetables, whole grains, dairy. So these are really the important additives or the important parts of our food that we must eat every day. And of course, make sure that you can get calcium, thiamine, and I will show you how we can make sure of that. All right, let's go to the next slide. Okay, so what do we need less of? Of course, salt, fat, saturated, sugar, and alcohol. And I'm so, I have to say that I get really tired of saying the same thing over and over again to my patients. Now, salt increases blood pressure. We all know that. So whenever, or anybody who is on blood pressure medication, this is another reminder. So please reduce the salt intake. All right. And especially patients who have, say, cirrhosis of the liver, they should never exceed the 2 grams of salt, or actually they should take less than that, and never sprinkle salt from over the top. So whatever, the vegetable, the saltiness of the vegetable, you just have to, accept that. And fats, yeah, excess fat goes to one place, and that is the liver. So the liver is like the junkyard, and all of that is going there. So, and what happens ultimately? The liver becomes big, it becomes, oversaturated with fat, and the cells die. And then what happens with the dead cells? They develop cirrhosis of the liver. So, you have to be very careful. And sugar, of course, diabetes, and alcohol. Alcohol destroys the stomach, the liver, the pancreas. I mean, I get so many patients with acute and chronic pancreatitis, chronic pancreatitis. Why? Just because of the alcohol, So it is really important that everybody, understand that the foods that we can or we should take and the foods that we should not take. All right, so let's go to the next one slide. All right, so this is slide number 16. And so what we need more of: whole grains, fiber, fruits, vegetables. So again, most people that I see have some problem with their bowel movement. Most of them come to me with constipation, and some of them come to me with diarrhea. So if you have diarrhea, I would not ask you to take fibers or fruits or too much of vegetables, okay? So because that's going to give you diarrhea. So you have to control those. But those who have constipated, they should take more fibers, fruits, and vegetables. And if you do not have any problem with your bowel movements, then of course, whole grains, fiber, fruits, and vegetables would be the best diet. The Mediterranean diet, okay, is most preferable. Let's move on to the next one. So, and I'm going to actually give you some examples. You can go over these, like proteins. Plant proteins are better, like quinoa, peanut butter. All right, next slide, please. And please, less of processed foods. I know some people, buy the processed foods because that is easy peasy. You're sitting in front of the TV, you want to just watch some program going on, and so you're just opening a can and just having it. No, because they contain added sugars, they contain added salts, and of course, please avoid white breads and grains, because they are going to not only cause you weight gain, but they're also going to cause you a constipation. Okay, and I have already talked about salt and alcohol and saturated fats. Please go to the next slide. Look at this lady, Ernestine Shepherd. She's 82 years old. Can you believe that? And she started exercising when she was 50 years old. So, and participation in any form of exercise, at least, 3 hours a week, or at least 30 minutes per day, 7 days a week. If you have a dog, take out the dog for a walk, so, and of course, if you can double that, like instead of 30 minutes, if you can make it 1 hour of moderate exercise, it will be even better. All right. So, and actually it has been seen that greater than 1 hour of exercise per week, moderate exercise per week, is associated with reduced dementia. And the risk increases if you are more, inactive, or sitting down and retired. Oh, I don't feel like working today. I'm not going out to work or doing something. So that is very important. Okay, exercise. So the recommendations, next slide, please. So the recommendations by CDC, by ASCM, is just 150 minutes a week of moderate intensity, or 75 minutes of vigorous intensity, or you can do any combination. And of course, as I said, extra benefits if you double the dose, double recommendations. You can just start with 10 minutes. I have some patients who were not willing to walk at all because their knees were paining or their ankles were paining. And I told them, if you can get into a pool, okay, you don't need to walk on the, even on the cement. If you get into a pool, you will see that you will be able to walk around, because being in water reduces your body weight by 1/6. And that gives you the buoyancy. And so the pressure on the knees and the ankles are much less. So they were able to walk around in the pool and they could reduce their body weight. And they were much, healthier from that. And just start with the 10 minutes and then go with an incremental 10 minutes each time, every week or every day, and it will do you better. Next slide, please. So, and another thing is the strength training, at least 2 days a week. So start with the smallest, say 2 pound, just that, and see how you can. If you cannot do it with one arm, just do it with 2 arms, and then go to 5 pounds, then go to 10 pounds, something. You don't need to like a huge amount, like 10 pounds is enough. Let's stop it there. 8 to 10 pounds is good enough. You don't need to. If you don't have anything to do like that, you can take a bottle and put some water in it, weigh it, you can use that. But, this is really important for, your bones, because the more strength training you do, your bones will become stronger. Okay. But do as much as your health conditions allow, but move. That is really the most important thing. Okay. All right. Next slide, please. This is now we are going on to the next topic. And this is regarding the foods which can help you to bounce back after surgery. A lot of my patients are undergoing surgery every day, especially as I was talking about the knees, the knee replacements. I see so many of my patients having that, or they're having some kind of abdominal surgeries. Many of them are coming to me with gallbladder taken out, or because I'm in GI, I have a lot of patients who have had the part of their colon taken out or something like that. Anyway, so they have to undergo surgery, and even then, even those people who are not undergoing those kind of radical surgeries, some patients are having cancer, or they're having mastectomy, removal of breast or something like that. So they have other surgeries going on, or they're having their thyroid removed. Anyway, so these are some of the very common surgeries that are happening these days. And you need to be prepared to bounce back after undergoing some of those surgeries, or any of those surgeries. So next slide. So this is a really important topic. So poor nutrition leads to poor outcomes. So if you are not, or if the patient is not, has proper nutrition, and either way, very obese, and they have to undergo, say, bariatric surgery, we tell them that you have to lose some weight. So if somebody comes to us like 500, 600 pounds, no surgeon is going to do any surgeries on them. They have to come down to less than 300 pounds, because obesity is actually does not give a good outcome for any surgery. So you have to be able to get off that weight. Okay. So, and we see that they have 3 times more problems after surgery, and 5 times more likely to die. And there has been a lot of research in this area, and I cannot go into those details about those researchers. I gave a big speech the other day at the Touro University on this malnutrition and surgery and recovery from surgery. But in short, next slide. If you eat well before surgery, you are less likely to die. So make sure your family, friends, please make them understand that even if they don't feel like eating, even if they're not able to smell or taste the food, it is very important for them to eat something and eat well before they undergo surgery. And this has to start at least 14 days before they, please go to the next slide. So these are the most important foods before surgery. So increase the protein, okay, meat, eggs, milk, fish, soy, poultry, or protein supplements, okay, whatever they can take. This should start at least 14 days before. Actually, this is known as ERAS, and a lot of research is going on in this area and actually a lot of doctors did not even know about this before 2020. Before 2020. And this is now coming into the US, and it's been taken up by a lot of hospitals, because in 2000, there were a couple of hospitals in Finland where they started doing some research and studies, and there they found that the patients who were more nourished, they were recovering faster. And that's where all this research and studies came into being. And now ERAS has become a very big integral part of most hospitals, and they take care, and this is known as part of optimization. So we check if the patient is able to undergo the surgery, and therefore we make sure that the patient is having enough nutrition. We take care of the medications that the patient is taking so that the patient can bounce back to life and very quickly post surgery. Okay, so please make sure if you or your friends or your family are undergoing surgery, they should have all these proteins and then supplements at least a week before and at least 4 to 8 weeks before surgery if they are very malnourished. And you can ask us about the nutrition and we will definitely be able to help you with that. I don't think you can see the next slide because this is on YouTube and I think we are going to have the same technical difficulties.
Let's try this one. I think the problem was we weren't on the right slide before. So hold on.
Okay.
Let me try. Can you still see it?
Yeah. As you get ready for surgery.
Oceanside Verbo is about to become the backdrop for an unforgettable vacation memory.
Okay.
Your nutrition is important to preparation for and recovery from.
So I have the video playing.
Yeah, I'm listening.
Okay.
Surgery. First, let's talk about malnutrition. Malnutrition can show up in different ways. Not eating the right amount of calories, unplanned weight loss, loss of muscle, swelling of hands and feet, or a reduction in functional abilities like reduced hand grip strength. Malnutrition is a strong risk factor for poor surgical outcomes. Malnourished patients are 3 times.
Hello? Did we lose?
The good news is, with adequate pre- and post-operative nutrition, mortality and complication rates are significantly reduced. So, in preparation for surgery, eat your protein. The best sources of dietary protein include meat, eggs, fish, poultry, soybeans, and nutritional supplements. These protein sources contain all essential amino acids, which are considered the building blocks of muscle and organ protein. Muscle protein can break down after surgery because of the stress placed on your body, but consuming more protein than usual can help reduce muscle loss. The recommended daily allowance for dietary protein is 0.8 grams per kilogram of body weight. With surgery, recommended protein intake increases by about double. So a 150-pound person should eat between 12 and 20 ounces of protein to get ready for surgery. This will occur between 7 and 14 days before your surgery date. This is similar to the amount football players consume when preparing for their seasons. In the 24 hours prior to surgery, you will also benefit from increasing your carbohydrate consumption. This aids in post-operative recovery by improving nutrient absorption. Even well-nourished patients benefit from elevated protein and carbohydrate consumption and reduce their risk of muscle loss. Talk with your healthcare provider about your nutritional needs as you prepare for surgery.
Okay. So, Jennifer, and I can now share my screen. I don't know. This is now, yeah, it's so weird. Yeah. So anyway, should I do that? I don't know.
It's up to you. We're pretty close to the end. I can just keep.
Okay. So yeah. I'll go to the next slide, please. So,
Hold on.
yeah. Okay, so the nutrition for pre-diabetes and diabetes, I'll very, to the next slide. All right, so type 2 diabetes is the most common form of diabetes, and but there is type 1 too. So we have to deal with both kinds of diabetes, but type 2, of course, is the most common. And that means that the body is not able to use the insulin properly. So some cases the body may be producing the insulin. In some cases, the body is not producing adequate insulin. And in some cases, the insulin is being produced, but that insulin is not active, sufficiently active to break down that sugar. Okay, so, and prediabetes, of course, is a milder version, but over the time, it can lead to diabetes. So 1 in 10 adults had diabetes. So this was the from 2018, and 1 in 4, like 25% of adults over the age of 65 are diabetic. And this is, as I was telling you, that I see this in my clinic every day. And there are so many patients who are not able to even control with metformin. So they have to be given, insulin and other medications. So what is better? To exercise, to eat healthy, to have a proper body weight, and, not be diabetic, right? So let's go to the next slide. And you can see that I think many of you are aware that when you go to your doctor, he or she is going to check for your HbA1c, and the fasting glucose. So if the fasting glucose is between 100 to 125, then you're good. But you're still in the range of prediabetes, which ranges from 5.7 to 6.5% of HbA1c. And as soon as you are over that limit, you get into 6.5% and above, the blood sugar, the fasting will be more than 126. So that is something which we want to prevent. Because let's go to the next slide. So the risk factors, I'm going to go very quickly. I think you can look up these slides also. Older age, if you have polycystic ovarian syndrome, PCOS, or gestational diabetes, and this is very common. If your baby was very large, like more than 9 pounds, then your chances of becoming diabetic later in life, is very high. Or if you have a family history, and of course, if you smoke. So there are a couple of things that you can actually get rid of. And that is, first of all, is stop smoking. Okay. All right. Next slide. So if you don't exercise, if you are overweight, if you have sleep apnea, so please get yourself checked and try to follow the rules of healthy aging. That's what I would like to say. Let's get to the next slide so that we can have some questions later on. So how to decrease your chance of developing type 2 diabetes. So if you, lose 5% of your weight. So for most people, it is like somebody is like 200 pounds. If you lose 10 pounds, that is 5% of your body weight, you're good. So that's not very difficult to lose, right? Losing 10 pounds. So just exercise 30 minutes, 5 days a week, eat less pasta and more protein, and stop smoking. Just very simple things, but we tend to kind of fall back and be a little lazy and not do this and do that, right? But if you follow the rules, if we stick to them, then we will be able to live longer and healthier. Okay, next slide. Right, and this is one thing that I will definitely say about sleep apnea, and I have seen a lot of people. I have seen some family members, actually, couple, who had great difficulty in driving. And then I asked them to get tested and for sleep apnea and treated, and now they are absolutely fine. So they can drive, they can enjoy life. So please make sure that if you hear your, somebody in your family who is having a hard time sleeping or having snoring, it's not, let's not just ignore that and advise them to get tested and treated for sleep apnea, especially if they're obese. And of course, certain medications can help, and weight loss surgery, though I'm quite against it unless the patient absolutely needs it. If a patient is like weighing 500 pounds or something like that, 400 or 500 pounds, and then they will need it definitely. Next slide. So there's a national weight loss registry, and you can track how people can lose weight and keep it off. Like eating breakfast is really one of the most important things that you can do before you get out for work. Step on a scale at least once a week. Less TV, please, and more moving, and then exercising at least I mean, about 1 hour a day, of course, that's the best. But if you cannot do that, do at least 30 minutes a day, take out your dog. And most common exercise is walking. I mean, that's really the best that you can do for yourself, especially who are like me. Okay, next slide. So, the cheap and fast, cheap and healthy, and cheap, healthy, and fast. So, try to choose something like this, which is like oatmeals, cheap, convenient, also healthy. All right, some salads. So you can prepare your own salad, and that is healthy. You can make it cheap, depending on what you put into your salad. Convenient also. So think of in those terms. So in a busy world, we are all busy working professionals. So we have to eat, start to think about what we are putting in our mouth and how we can remain healthy. Okay, next. So these are the complications of diabetes. I'm not going to go into the details because I've already discussed some of them. Next line. And these are more complications. You can read through them. Next. I think a lot of us know about what carbohydrates are, milk and yogurt, but I want to go to the next slide. And fibers. I've already talked about fibers, and most people have only 10 to 15 grams per day. Please increase your fiber content if you're constipated or even if you're having normal BM. And so that is very important. And that may help you live longer, okay? And make you feel full. All right, next. So this is what I wanted to come to about understanding a food label. So please read the food labels. And if you cannot read them, if they're too small, please bring a pair of magnifying glasses to read them before you buy. Next. So I've given here 3 labels. I'm going to go very quickly through them. Look at this, added sugars. So these are 3 boxes. So added sugar is 12 grams. This is 24%. This is 36%. And in here, this is also 18%. But look at the dietary fibers. This is 22%. Here, dietary fibers is only 12%. And here 7%. So which one are you going to buy? So you have to choose between. So I think I would go with this because there's a dietary fibers and then the sugars are also much less. So there's a kind of a balance. It seems like it's more balanced, right? So, and also look at the serving sizes. So this is 3/4 cup. This is 1 1/4 cup, and this is 1 cup. So when you buy, please look at the calories that they are, giving you. So it's very important. Next slide. I think we are almost at the end now. This is the plate method. And I talk about this all the time. Jennifer, is it okay if I'm going over a little bit?
Absolutely.
Okay, so because this is really important, you see, and I talk to my patients about this, and sometimes you can actually get these plates out in the market also. So half a plate of vegetables like cabbage, cauliflower, broccoli, asparagus, so they can fill your stomach, okay? You won't feel that you have to eat once you have had those non-starchy vegetables. And then, of course, you would need proteins. So, lean proteins are the best. So chicken, fish. I tell my patients not to eat too much of steak or, fatty fish or something like that, because, we just discussed about the fats, which have to go to the liver, which we don't want to overuse. And then 1/4 plate of grain and starchy vegetables. So we all love grains because that's the crunch and that's really tasty. So we really have to have a little bit of grains, but try to, eat in these proportions so that, and also I would suggest that don't take a 9-inch plate, try to get a 6-inch plate because, and if you need to have a second serving, go for the vegetables, the non-starchy vegetables or the lean proteins, one of those, not the grains, okay? But unfortunately, most of us lean towards these grains, right? The cakes and pastries and those tasty stuff, but try to limit them. Let's go to the next slide. So okay. So these are, as I said, that let's understand type 2 diabetes. And these are the things which I've already talked about. So smoking, if you are overweight, so check your weights at least once a week. If you are having a sedentary habit, or if you have to sit at your office desk, 5 days a week, 8 hours a day, that's really tough. But every, say, half an hour or 1 hour, if you can get up and walk about a little bit, nobody's going to say no. So, and limit your, lunchtime. So divided it into 2 parts. So one part, you just quickly have your lunch, and the next part, just walk about a little bit if you have some place to walk about, because that's really going to allow you. So they say after dinner, walk a mile. I would say after lunch, walk a mile, or at least half a mile if you can. So that will, half a mile, 1 mile a day, not bad. And then try to restrict cakes and pastries. Get your blood pressure checked, get to your doctor, get all your, check for your blood levels, the diabetes and all of that. And of course, restrict your bacon. All right. Next slide, I think. Any questions?
So it looks like we don't have any questions. So I want to thank you for joining us today. And I hope that you've gathered some good information that you can apply towards the future. And for information about more of our upcoming programs, you can visit our website, fortworthlibrary.org. So thank you, and everyone have a good day.
Jennifer.
Bye-bye.